This is a Q&A session on leadership opportunities, and I'll pass it on to our speakers to introduce themselves.
So hi everyone, thank you for coming this morning. My name's Joe. I'm a SHO or a junior doctor working in North Manchester, in Greater Manchester. I was a student at the Peninsula Medical School where I took a year out to do a master's degree in medical law. After finishing that, came up to Manchester to do my foundation. I'm currently doing a leadership fellowship at the organisation I work at. And I'm also luckily going to be working in the Health Foundation from August as a National Medical Directors Leadership Fellow. Aside from sort of my job, I suppose, I've got other responsibilities and roles. I'm a BMA rep where I sit on the National and UK Junior Doctors Committee, where I work as a negotiator on the national contract that you may have heard about in the last few years. And I also do some research for the University of Salford. So, hi everyone.
Hi, I'm Sophia. I am a dentist by profession. I work, clinically in Max Fax department in Broomfield Hospital, which is in Mid and South Essex. I'm currently a senior clinical fellow within the Mid and South Essex integrated care system, and I entered this fellowship year having done a previous fellowship with the Chief Dental Office and FMLM last year, where I was in Oral B. Clinically, I've spent, after my foundation year, so I started dentistry as a graduate entry program and did my foundation training in a practice in Buckinghamshire, and then have spent the rest of my clinical career in Max Fax units in the East of England region. Outside my clinical role, I also do quite a bit of mentoring, and currently sit on the dental strategic oversight board, which is looking at how we can increase inclusion within the dental profession.
I guess with Joe, I mean, you have right now, how did you kind of go?
Yeah, so I think I've got a bit of a mixed portfolio at the moment, I suppose, and they've all come around somewhat organically. But probably the most interesting role, which I think might be useful to talk about, is the role that I'm doing at the moment with my current trust. So that's a fellowship role which we put together with me and the medical director following the COVID-19 pandemic. So we went into the pandemic in March 2020, and we were looking at sort of horizon scanning and seeing this huge ask of junior doctors across the nation, and particularly in our trust. So I spoke to the medical director, and who I had a reasonably good relationship with due to my BMA role. We weren't always on the same team, I suppose, but he sort of knew me as someone who advocated for junior doctors and for staff across the organisation. And we looked forward towards the pandemic, and it was quite clear that we were going to have a huge pressure on our services. Junior doctors were probably going to be redeployed. We were going to stop all our elective activity and look to just move towards emergency services. And I met with the medical director, and I said, well, actually, this is going to be quite a long process. This is going to be quite arduous, and actually, if we really want to get the most out of our workforce, we need to make sure they're very engaged in the process and make sure they feel that they've been heard. And this is on a background of other trusts across the area. Some of our neighbouring trusts were imposing things on junior doctors sort of overnight, really. So a colleague of mine was working in a major trauma centre next door, and she told me that within 12 hours she was taken off her training job and put in ICU on a different rota in a department she'd never worked in, with no induction. And of course, there's a myriad of patient safety issues there. There's problems with staff morale and well-being if you just do something that they don't have a choice in. And the medical director said, yeah, that's a pretty good point. So here you go, so you can take this. So he asked me to step back from my clinical work and lead the redeployment and reorganisation of services at the trust. And that went quite well. We were able to give each junior doctor in training 2 different choices of where they'd like to go. we gave them a choice, then each junior doctor got either their first or second choice. So we were able to align it with their training needs and where they wanted to go, and sort of also their out of work needs. So some people couldn't work in certain areas because of family pressures and so on. And this is on a background of the hospital I work in had quite a poor reputation for junior doctors across the northwest. Actually, it was seen as a bit of a how best to put this, a rite of passage. It was not a good training experience. It was actually really tricky to work in. We had really poor results in the GMC training surveys, and we had really poor engagement from the junior staff. So we did all this, and the juniors could see that actually all of this was led by a junior doctor, and they were given choices, and they could contact me if there's any problems. And it really increased that board to ward level communication, which is spoken about so much in the care report and how we can avoid mid-staffs again. And it got to around this time last year, and I said to the medical director, you know, this is quite an important role, I think, and I think it'd be really useful to continue this, and either with, ideally I'd love to do it, but if not, then someone else. So we put together a business proposal, wrote a business case, presented it to the board, and got funding approved. And I guess in some ways, you know, I looked to the FMLMs, the Faculty of Medical Leadership and Management, who were doing these leadership fellowships. And that was where I kind of got the idea from to do this, but do it at a more local level. And then that, happily, that passed the executive team, signed it off, we got the funding, and I came into post. So it's quite a novel job, the one I'm doing at the moment, but the trust has seen huge benefits from it. I think we've again submitted business cases and proposals, and we've had a commitment from the senior team that this is going to continue for the longer term. And I think having junior doctors in leadership positions within organisations is really quite important. And one of the reasons that, sorry, Siobhan, I'm going on a bit of a tangent here,
No,
but so junior doctors, you know, are really, really important to the running of a hospital, particularly out of hours, particularly overnight. But actually, you know, without junior doctors, hospitals can't provide safe cover overnight. That's quite clear. But junior doctors are very, very rarely considered in organisational decision making, in how we structure our services, and they're not often considered substantive members of staff due to the rotational nature of their work. So that can lead to really poor engagement from junior doctors, poor discussions with them on decisions which have quite big impacts on their lives. And then that leads to poor retention, poor morale, and poor well-being amongst junior medical staff, and is one of the big reasons that actually we, as junior doctors, we can't offer the best care that we'd like to, because of sort of factors outside of our control. So by increasing that representation and increasing the voice of juniors within an organisation, it really improves the engagement and well-being. And also what we've seen is as we recover and move out of COVID, all of our services do look different to when they went in. And actually the services we've restructured with junior doctor input have been much more successful than the ones without junior doctor input. And that has largely been because junior doctor are able to stress test things, we're able to say how things would actually work on the ground. And that's not to say that management-led decisions or hospital management board-led decisions are not important, but without having that frontline clinical worker input, it's often very difficult to understand how that will actually work in practice, I suppose. So that's sort of a really roundabout way of answering your question, but I think it's really important to reiterate that, you know, junior doctors are actually critical to the mission of a hospital, particularly out of hours. And they often have doors shut in their face, and, you know, people say, you know, junior doctors should be doing clinical care, not being involved in leadership and management, but actually that's somewhat short-sighted in lots of cases. And I think, you know, people like the FMLM are really pushing this and pushing the professionalisation of medical leadership and real teaching and training opportunities which junior doctors have not been able to access in the past. And, you know, going into a management board and meeting and being able to speak the same language is absolutely crucial, because the job that I'm doing now, you would walk into a senior meeting and people would often be quite dismissive of you because you didn't really follow the conversation, because it's sort of similar to medical language. It's quite technical lots of the time and the sort of jargon. Whereas if you can be on the same page as managers in that respect, you really have it's much easier to break down those barriers and work together.
Amazing. I would yeah, you probably have had other experiences previously. So how did you actually get leadership role at M&M, or is it necessary? Someone sort of said, how was it because they feel like they're missing out on a lot and they don't really know where to find them?
Sophia, do you want to take that? Do you want me to? You're on mute, sorry.
Sorry, Shivani, you went a bit digital there, so I'm just picking bits of what you said. So I think the question was about how do you find these opportunities?
Yeah,
right. Okay. So I suppose for myself, I had always got involved with just various different forums and networks, even when I was at dental school. So as part of the staff student council there. And I think that generally there's something about not saying no to opportunities. And then throughout my core training, dental core trainee rep, and this puts you in contact with lots of sort of leaders and mentors. And so one thing is that when there are opportunities, you will hear about them in these. Then yes, social media is a really good tool to use. Twitter, things are always advertised on Twitter. And I suppose if you're involved in lots of different networks, so for instance, the BMA Young Professional Networks, these opportunities tend to arise in there as well. And I just think it's often the more you get involved with is the more you start to hear about. And often it's sometimes just conversations. You can even create opportunities as well. So it's not always looking for an opportunity. There's also sometimes having the opportunity to create, maybe starting a small project, which can actually lead to much bigger opportunities.
Yeah, I think I would agree with that, Sophia. I think there's sort of two different ways of approaching this. So there's local leadership opportunities, and that could be within medical school. So in medical school, you could get involved in organising conferences, organising committees, and as you move and make that transition into work, you can get involved locally in the BMA. And I think the BMA is certainly where I started this leadership journey. You get lots of training opportunities, exposed to some really quite amazing people who are quite inspirational and quite a lot further on in their leadership career. And I think sometimes people can be a bit dismissive of things like the BMA, but actually, they're a political organisation that really have massive impact and influence on the medical profession and outside of the medical profession as well. So I think they do lots of good things, but even if you're looking at it from a development opportunity by itself, I think it's really useful to get involved in. And I think that there's lots of opportunities to get involved in regional and national things. You can see them via Twitter. LinkedIn's really useful as well. I would recommend using LinkedIn, and I wouldn't rely on Twitter or LinkedIn for everything, but actually they do have their uses, and that they are really good at linking people up. But in terms of sort of more local things, if you're the person who goes to your clinical director or goes to the medical director or goes to the dean of medical school and says, I've recognised that something I think needs to change, and I think that also I can bring a solution to that. What do you think? And people will very rarely say no to that. People will very rarely turn you away if you're genuinely looking to improve things. And that's sort of what leadership is. Lots of people talk about leadership as a status or a title. They want to be the medical director, they want to be the divisional director, but actually leadership is about continuous improvement a lot of the time. It's about how do you make that happen. So if you can show that you're keen, every department everywhere in the UK needs to be. There's no perfect healthcare department by any means. So if you go to someone and you say, look, I'm really motivated and I think I want to make a change, and either show me how I can do that or tell me where I can go to do that, people will be quite receptive most of the time. And if you're the person who is around those meetings, and you say, can I get invited to that meeting? Can I come to this? Can I speak to these individuals? And the NHS, while it's a huge organisation, is made up of a myriad of much smaller networks. And if you're the person who's always there, sort of asking, you'll end up being the person that people will ask for. So if anyone needs any junior doctor input in my organisation, I tend to be the person people go to. And then I try and direct them to people more appropriate. But actually, I'm sort of known as the junior doctor within the leadership team. And if you start to sort of have your face around there, then I think that's really useful. The other aspect that I would say is that make sure you go into a situation or go into a meeting or whatever it is well prepared. And I found this early on in my career. You know, as the BMA rep, there was lots of problems with junior doctors had at the organisation that I work in, and in the first few times I tried to raise these things, I raised them sort of on anecdotal evidence. I raised them without having a full background knowledge of the subject. And it's actually very, very easy to be turned down or turned away in those situations. And a consultant gave me some really good advice. He said, you know, if you want to make a change, if you want to see something happen, go into that meeting, go into that forum, and make it impossible for that team to say no. Make it embarrassing for them to say no. And he was introducing a service across Greater Manchester, and he'd done lots of original research around the service about the benefits of the service. He'd done a cost analysis. He'd spoken to MPs locally. He'd spoken to local community healthcare providers. And if you go to a board and you say, well, actually, I've got these quite specialist opinions and these quite influential opinions, and I've got data to back it up, and no one's really going to be able to say no to that with a clear conscience. And I'm not suggesting that every time you go to a leadership or you try and do a project or go to a leadership forum that you need to do a full cost benefits analysis. But if you show that you've had some good deep thought about the problem and thought about how you can improve things, people will see that sort of the genuineness in your want and need to make improvements. And there are very few organisations where that won't be received well.
I would also say that there's something about your actual own personal development about the organisation you worked in. So when I went into my first core training post, I didn't go in with an ambition to find a leadership opportunity. I just wanted to get to know about almost the politics of how a hospital runs. So I used to sort of just go around and talk to managers in the hospital. When they would come onto the department, I would speak to them, and through speaking to them, they would direct me to different people to speak to. Even when I was doing sort of like my quality improvement activities, it was a personal development. I just wanted to know, how do things run? How do you get change to happen? And in doing this, you also start to find out what are the barriers and how do you move around the barriers? Because often when you want change, you just think that if I just go and speak to the right person, it's going to happen. And you have to realize that actually people before you have tried to make change, and there was a reason why change wasn't happening. So finding out how to make change happen is probably one of the biggest tools. And I think you do that through conversations and relationships and knowledge building.
Question from Joe Pybus in the chat. Thanks for the question, Joe. It's given to the rotational nature of junior doctors' work and training and changing posts 4 monthly, how do you ensure continuity? And I'm sure Sophia's got some thoughts on this as well. But in terms of my experience so far, I think it's crucial that you have, because junior doctors do move, and even though FY1 doctors, for example, move every 4 months, moving within the organisation isn't too difficult to keep that continuity. But if you, as soon as people move outside of the organisation, then it becomes much more challenging. And it's about having sort of institutional memory. And within my BMA role, I could see that as people moved in and out, you know, we might get very close to a good result and implementing something. Then the driving force behind that changed into a different out of the area or so on. And I guess the crucial part for me is that you have really good handover to new people coming in. If you can identify them, which isn't always possible, but if you can identify them, then ensuring you have a good handover and having a good digital record of that. So that's minutes of meetings, things like action matrices and action logs to track the actions, whether they've been completed, and making sure that you identify the person who's been in the role before you and try to get the learning from them, but also is there anything that you need to pick up? And then on the other side, when you're leaving an organization, trying to identify the person after you and passing on some of that learning about what works, what doesn't work in those particular circumstances. But also, if there's anything that, you know, ideally, if they could carry on for you when you've left, then to go on. But Sophia, do you have any more thoughts?
No, I think I agree. I think you cover that quite well. I think it's just sometimes being aware that you are just the short time that you spend at an organization, just being quite mindful that the effort that you put in is part of the bigger picture. So sometimes it feels like you've only contributed a small part, but actually it's all part of a bigger picture, and just being very mindful of that and learning at every opportunity you have, actually just finding out what was the learning within that and taking it on to the next opportunity.
So somebody has asked, I guess this could apply to dental school as well as medical school. What can you sort of do to showcase leadership? Does it have to be kind of joining and becoming a BMA rep, or are there other things that you can do instead to get these kind of roles in the future?
So I think from a personal experience, I was not involved in any leadership within medical school. I was involved in a few committees of societies, but not really anything that I really considered to be leadership development or leadership opportunities. That really started when I was an FY1, and you know, as I sort of mentioned previously, I recognised that we had to make some changes at my organisation because I didn't feel that it was what was happening there in terms of the junior doctor experience, the way we were treated as employees was acceptable. And my means of doing that was to initially join the BMA and then become a representative. And there's no reason to say that you can't do that during medical school. I've worked with some people who've been BMA reps from sort of day one of medical school, and by the time they leave, they've been fantastic speakers, fantastic leaders, really able to instigate change at sort of the systems wide and national level, which is quite inspiring, really. But you know, you don't have to do it via the BMA. They do open lots of doors, and there's lots of great opportunities, and there's a degree of protection that comes with being a BMA representative, which is legal protection afforded by legislation. But I think, as I said before, if you can identify individuals, so if you're a medical student, it might be the head of department, or it might be the head of faculty, or the dean of the medical school, or someone out with the medical school and within the wider university. And if you can identify something which you think could be improved, then there's no reason why you couldn't approach one of the leaders at your organisation and just say, I've identified this problem and I really think that a change is necessary here. And there's been some really good examples of that in the UK over the last few years. So Melanin Medics was started by a medical student as an organisation as a network, I think, of support for medical students from different ethnic minorities, which are underrepresented in lots of different forums, including organisational decision making, and including the BMA as well. And that wasn't done by the BMA, and that was certainly done off someone's own initiative, and has been really impactful and really successful. And I suppose within leadership, which I sort of maybe alluded to before, lots of people go into leadership with the idea that they want to get a title, they want to get something on their CV, they want to be in a position of power somewhat, and a decision maker. But actually, the people I know who've become the best leaders and the people who've had made the best opportunities for themselves are the people who didn't go into something with the aspiration of being considered a leader. They've been the people who've gone into something just wanting to make a change, because they've recognised that the current situation and the current way of doing things is not appropriate, or is not acceptable, for their current medical school or for their current hospital, and then they've sort of learned along the way, and you get that experiential learning of what it takes to be a leader, what it takes to make a change and motivate others and manage expectations and manage stakeholders. Whereas if you sort of applied for a senior leadership position in an organization without that experience, you might find that you're sort of scrabbling to find the skills very quickly to be able to manage that, I suppose. But Sophia, what do you think?
I agree. I think university is actually a really great place to find leadership opportunities. I think probably you might not realize that some of the things that you are doing is actually developing your leadership. When I was at university, I was part of the Staff Student Council. I helped organize various events, and even something as simple as being the lead for our global brigades, which was sending dental and medical teams abroad for their elective. And I didn't see those as leadership roles. I just saw them as things to get involved with. And I think that just identifying gaps. So I know that there was a group just when I was leaving who set up a women in dentistry student society, and that's gone from strength to strength. And that I'm assuming they didn't think I wanted a leadership opportunity. They just identified that actually we would like a group that was tailored towards women in dentistry. So identifying groups, gaps, and having sort of like-minded people around you. Try not to do these things on your own. It's always better to have people with you, supporting you, and identifying some of your leaders, finding a mentor within your dental school, medical school is really useful, and they will support you and give you some of the tools just for having particular conversations.
Okay. In terms of getting into these roles, did you have any prior training or did you go on any courses? I guess it leads into the question of how to develop leadership skills. Do either of you have any answers for that?
Do you want to go, Sophia, then?
So I didn't. My development or training is probably just life experience. So I went into dental school as a mature student, and had worked in my professional life. So I had some elements of leadership understanding then. For my fellowship roles, it was, I mean, you get training in these programs anyway about leadership, but actually it's more about the ambition and the enthusiasm that a lot of these roles are looking for, rather than you coming in as a sort of fully formed, polished leader. So it's your, what's your motivation for being a leader? What aspires you to see and want to make change? So I think it's that sort of, do you have these skills where you're quite perceptive to your environment, to why you want to make a change? Is it because, is it staff that you're concerned about? Is it patient care? What motivates you and drives you to see change? So these are the things that I would say you want to showcase more than, I know how to do a gap analysis or something like this. These are things that you will learn as you go along, but it's really your sort of core values and principles that is what people are looking for in leadership.
Yeah, I would agree with that. I think there's definitely, you can learn lots of the skills, and you do pick up things along the way, but what you can't necessarily learn and what you sort of move into it and showcase, as you said, Sophia, is that passion and that real want to develop change and improve things. That being said, I think there is opportunities to pick up some of the more technical skills. So for risk of sounding like a broken record, the BMA offers training to its reps, training which actually, if you look to fund privately, would be quite expensive, and that's training in negotiation skills and leadership, sort of recognizing difference between individuals and identifying talent, which has been really useful. I think you can also look out with the medical profession. So I'm quite lucky at the moment that I'm studying towards an MBA degree at a business school. And And I went into that actively looking for opportunities and experience outside of healthcare, to see how, you know, we could look at other industries and bring the learning in. And there's nothing to be lost from looking at leadership in other organisations, the private sector, the corporate sector, to see how we can improve things within the health service. But I think probably, if rather than sign up to lots of often expensive leadership courses or anything like that, I think just getting involved where you can in anything, I suppose. If you go into it, as Sophia said, and you say, yeah, I'm really passionate about something, how can I help in that particular area? That's much more useful to yourself and to wherever it is you're working than looking for a leadership opportunity per se, which you just, I guess, kind of want to do for as a more of a tick box exercise than really being passionate to make a change. And change is very difficult to do in lots of organizations. There's lots of barriers to change. And if you go into something thinking you want to get a leadership opportunity out of it, then actually you'll probably find that at some point it'll be really hard to continue that momentum and keep it going. Whereas if you go into something because of a passion to change, when the going gets tough, it's much more easy to pull on those sort of resources within yourself. Then, you know, there's lots of times people close doors in your face and people stop a project you've been working for several months on. And if you're just doing it as a leadership opportunity, then it's much easier to walk away than it is if it's something that you're really quite passionate about.
Okay. So maybe it's sort of like a scenario, I suppose, but say if you were leading a group of peers, how would you make sure that everyone is sort of staying on task without seeming overly pushy or demanding or maybe even micromanaging? Have you ever sort of faced those situations?
I'll let you go first, Joe.
Yes, that's a tricky one. And leadership, I guess, slightly different things in lots of contexts. And that, in some ways, you're talking more about management than leadership. How do you, from it? Yeah, it's quite difficult to, because I think the first thing I do is recognise that everyone's got lots of competing priorities. So actually, while something might be very urgent for me and something that needs dealing with on the day for me, that might not be the same for the person I'm working with. There's absolutely no one in the NHS who works with only one priority at any one time. Everyone's been pulled in all directions. But if you're looking for ways to motivate people to take on change, I would recommend, there's a book by John Cotter, who's a Harvard Business School professor, and he speaks about an 8-stage process of eliciting change. And it's not something that you need to follow all the time, but actually they're quite useful things to think about when you're trying to start something or make a change. And off the top of my head, I can't quite remember all of the stages, but one of them is creating a sense of urgency within a team. And I guess that's communicating and making the team that you're working with see the value in the change that you're doing. It's actually very difficult to make a team take on a change if they don't believe in it. And another thing he talks about is developing a guiding coalition. So if I've got a group of junior doctors and we're trying to think about how to introduce a new change to hospitals, so one we recently did was we're working on introducing prizes to recognise the hard work of junior doctors within the trust, because we feel that they're not appropriately recognised when they go over and above their sort of normal line of work. And although it's a group of junior doctors doing this, the guiding coalition's got to identify the key stakeholders, and one of the key stakeholders is the medical director. So when you walk into a senior meeting and you don't have the medical director, if they don't know about the project or they're not buying into the project, it's very difficult to get that past some of the other senior people. Whereas if you go into a meeting and you've already briefed the medical director, they're already on side and you've got good buy-in, then they will back you in that meeting and you've got much more chance of success. So there, I guess, a few of the lessons that I've learned. But I would recommend reading. John Cotter's got a few books. He's got some quite interesting books, which I articulate these 8 stages of change in more of a fictional context, which are quite fun, and they're quite cheap, or you can find them for free in PDF online, which I would recommend.
Yeah, so I would say that being really clear in your communication is probably one of the most important thing when you're working with a team. So I don't think you have to micromanage or be a dictator, but if you're really clear in what is it that we're trying to achieve, why we're trying to achieve it, and just almost like a shared vision. So why is this important? And sometimes it's important almost from a sort of passionate point of view, and sometimes it's just something that needs to be done, and we all need to club together and get this done. So it's really just that the team understands from the very beginning, what are we doing, and then valuing the people that you work with. So knowing a bit about them and what are their other, as Joe said, competing priorities. If you just have a bit of understanding about what is it that they're carrying in their bucket at the moment, and it gives you that space to maneuver around if they're not going to be able to meet a deadline, who can pick up the slack. So just taking a bit of time to know your team. Yeah, I think that's it really, just acknowledging people as part of a team, trying to make it as fun as possible. That sometimes helps, at least just having some space to be a bit lightweight, not making it too heavy and task focused.
Yeah. So I guess on the other side, have either of you experienced bad leadership? And if so, what did you do, or did you approach that in a particular way?
So on my leadership journey, I actually think I value bad leadership the most, because I think that teaches me the most. So actually, I've said to many other people who are coming into sort of different leadership development roles that actually the best leadership you can learn from is the bad leadership, because it teaches you what not to do. So when I see bad leadership, I sort of learn more from it than even the good leadership. So if you do see bad leadership, I think there's something about keeping your distance, but actually really just observing it, observing the effect that it has around the sort of immediate team, the organization, and really understanding why that is an attribute you actually do not want to have, and think, how can I not be that leader?
Yeah, I think that's really insightful. Actually, I think you see good leaders, and it's often very difficult to identify why they're good, and why they're inclusive and all that sort of thing, why they're good communicators. Whereas if you see quite bad leaders, it's much more easy to pinpoint areas that sort of develop yourself, I suppose. I've worked with some really quite inspirational people, I suppose, in my short career so far. But I've also worked with some quite challenging people in quite senior positions who've got a very fixed, and I would argue perhaps outdated, way of doing things, in terms of a very hierarchical approach, a lack of transparency in their thinking, that a board level decision should be seen by the board and no one else, and the frontline clinical staff don't need to be involved in that, and they certainly don't need the information that was used to make that decision. And you can see that at all levels. I think you can see that within how the central management of the pandemic has been. There's been times when there's been good transparency around decisions. There's been times when there's been really poor transparency around decisions. And I think that's really useful to sort of reflect upon. I suppose one thing which I have learned this year, the hard way, I suppose, is it's also really crucial to recognize that your relationships with individuals, with teams, with the organization is going to be longer than that single difficult scenario that you're working in. And lots of people describe this as the hill you choose to die on, which is sort of a metaphor for you need to choose your battles wisely, because if you're working in a hospital and if you approach the management team and really caused a big stir every time you recognize that something very, very small was happening, or very, very small needed changing, that doesn't create a collaborative relationship. And it's collaboration and acknowledgement of the other side's or other individuals' perspectives is really useful to create a good working relationship moving forward. And if you're the kind of person who always goes with, I guess, a complaint, but not approaching it in a collaborative way, you'll find you'll actually have lots of barriers in front of you. And there's certainly times when an issue is so big or so crucial that you do need to stand up for yourself, and you will not take no for an answer. And they're the hills you choose to die on, and they're the ones that you really put all your weight behind, and don't take no for an answer. But actually, for most challenges and most problems, it's much better to develop that collaborative relationship, so that at some point in the future you will have something which is really crucial and you need to stand up for yourself. But you also need to have that good relationship to start with.
Yeah, and I would also add that one thing about when you see bad leadership is actually trying to understand why they're acting in the way that they're acting. And actually it probably puts a bit of distance between you and yourself if you can actually sort of get behind the facade of why are they making the decisions that they're making. And you will actually start to see that sometimes a bad leadership actually could be driven by the sort of pressures that they're under or the organizational culture that they're within.
So I guess both of you spoke about kind of collaboration and relationships and things like that. How did you kind of go about making sure those relationships were stayed intact? Maybe, I guess, if there are some issues in the hospital, for example, and you're sort of saying, I'm not happy with this, was that not met with kind of disagreements and things like that? So how did you manage that and make sure the relationships sort of stayed intact?
I think it depends on how you approach something. So there's no point sort of storming into somebody's office and saying, I don't like this, I want change. So I think firstly, it's finding out why a system is the way that it is at the moment. I think when you are quite young in your career, you do tend to think, I want change, it should happen. But actually, why is that system the way that it is at the moment? And conversations actually just with almost no agenda. So I just want to find out why do we do this? So asking lots of questions. I think why is probably the best question you can ever ask. And then you will start to find out. And once you find out the whys, you might start to say, well, what about if we try to do things like this? So I think sometimes posing a question as opposed to posing a solution actually opens up a better conversation than saying, we have to do. Maintaining relationships, I think if you actually start your relationships off by not wanting something, I just want to get to understand you, and being friendly with people, you will gain a lot more than always going to people with an agenda.
And I think there's something there around reducing the blame attributed to individuals and having that no blame culture. And as you say, Sophia, it's if you approach something as a question rather than more of an accusation, it's taken on much better and it causes people to think. Whereas if you approach something with an accusatory sort of tone or email or however you choose to do it, it typically gets people's backs up, and at that point you find it's very difficult to come back from. And this is the same across all communication skills, not just in leadership initiatives. So if you're on a consultant-led ward round and you think that perhaps the current guidelines for a decision they've made are slightly different, it won't create a good collaborative relationship if you, in front of their colleagues and the consultant ward round, tell them that you think they're wrong. And I'm sure we've done this in medical school as well. And you say, well, actually, I just wondered why we did it this way as opposed to this way. And approaching things and framing them as a learning opportunity is a really good way of creating that collaboration. Because actually, as well, there's lots of times, well, most of the time, we will be wrong, and there'll be a perfectly good reason that something's done in a certain way. And if you approach it as a why rather than a you should have done this, then it just creates a much better learning environment for everybody.
Mm-hmm. And I think, Joe, in the beginning, you kind of mentioned your role in your hospital and how redeployment of certain staff was kind of affecting morale. Was that something that you were able to change, basically? I guess if you could talk about what kind of happened.
So I think we were able to offer a lot to those to the trainees. We were able to offer certainly a lot more than most other trusts. We could give people a big choice over where they wanted to go, and everyone had their first or second choice of which department they wanted to work in. And I guess that wasn't done elsewhere because it was a huge administrative burden, which there was no capacity for, and it was just useful that I was freed up from my clinical work to do that work. But I think more than anything, it's making people feel heard in an organisation. Junior doctors and junior clinical staff are often have quite an infantilized relationship with senior management. They are told what to do, they're told where to go, and they're not given a great deal of autonomy over their work. And to some degrees, that is essential because that's the nature of a training program and you're there to learn. But actually, if you treat employees, we're all adults, we're all professional people. And I think that goes for medical students too. That actually infantilizing people is not useful. It doesn't create a learning atmosphere. And I think there's a historical idea in medicine that if you shout at people, they will learn. But the evidence suggests that if you shout at people, they get disengaged. And it's not shouting at medical students is quite similar to telling junior doctors what to do and having they get no input into that decision at all. So by creating that collaboration, it improves morale, but it also invites challenge, and it invites people to speak up and invites people to say, well, I wasn't sure that what we were doing was probably the right thing. And that drives up the quality of care, and it drives up the quality of relationships between doctors and allied healthcare professionals and doctors and senior management as well. Whereas if you treat them in sort of an adult-child kind of relationship, then it doesn't create an atmosphere where people are willing to speak up. And then that leads to a situation that we saw in mid-staffs a few years ago.
I think parting words, it's been really useful, especially I was into yeah, awesome.
I just want to say thank you for having me. I think if anyone wants any advice or anything, please do just reach out on LinkedIn or something. I'd be more than happy to have a chat. But just if you take out the idea of reaching for leadership opportunities and you just have in your head what leadership is, and that is making things better, making change, and transforming healthcare as we see it today to keep up with the needs of the population, and identifying how you can best do that. And actually, if you do that, then you will be given opportunities, and you will be in the right place at the right time. And that, to me, is what leadership's about, and that's how you get opportunities for yourself. So, but yeah, like I say, feel free to reach out to me at all. And thanks very much for having me. I think it's a really good conference.
Yeah, so echoing what Joe said, thank you for having me. It was great talking to you both. And yeah, I think that just be mindful that you are leading every day. So just keep looking around you. There's lots of leadership opportunities, and be open and don't say no. Unless you've got too much work to do, then please know when to say no. But I wish you all the best of luck and hope to see you all. And I'm also on Twitter if you want to reach out as well.
Great. Thank you both so much.